The 2019 Interdisciplinary Spine Conference on Spinal Stenosis will be held in Fort Wayne, Indiana on September 28 and 29. This is a conference on spinal stenosis, the condition that is reported to cost more in human suffering and dollars than any other chronic spinal problem. In this conference, we will have experts in the field of diagnosis and treatment, and it will be an atmosphere of congeniality, not competition. Why? Because the patient who has back and leg and radicular pain, we know is confused over who to see. They travel what we call like a supermarket of practitioners. Many of them start with a surgeon. Well, what percent of people go to surgeons? Well, 3 million people studied found that 0.8% of them go to surgery. Well, that means that 99% don't go to surgery, therefore they are going to be treated non-surgically. To that end, in this conference, we know that the best conservative treatment is necessary to do two things. Number one, lower the incidence of spine surgery, and number two, to lower the opioid epidemic of chronic low back pain in our people. So in this conference, we will cover neurosurgery, orthopedic surgery. We will cover spinal implants in chronic pain that is irreversible. Many people who have had back surgery and still have the pain. We will have chiropractors speaking from interdisciplinary practices where they're involved with medical doctors, osteopaths, physical therapists, nutritionists, occupational therapists as a part of an interdisciplinary team. We will discuss depression and mental attitude in treating chronic pain because people become depressed, they become anxious, they become fear avoidant. Yes, many of them so severe that they contemplate suicide. So it's very important that we cover all of these aspects. We will also discuss an interesting topic of incontinence. Incontinence, both rectal and urinary, that accompanies spinal stenosis. To that end, we'll have a prominent urologist speak on the use of sacral nerve implants to control incontinence. We will discuss balance. Balance is a problem of people as they age. And chiropractors' non-surgical treatment must be involved in helping people regain their balance so that they do not fall, which can result in rather disastrous clinical outcomes. We will then discuss the mind-body connection, the importance of accepting a health problem, committing to its treatment with a team effort between the treating practitioner and the patient, and form the best therapy to give that patient the best clinical relief. This will be a conference that can be held and beneficial to any healthcare provider of people with back or radicular pain. You are invited to attend, and incidentally, all proceeds from this conference will go for further spine research to help the public that we serve.